We have a number of questions regarding Johnson & Johnson. Christine Ferretti points out that at the recent briefing, you'd suggested that the Johnson & Johnson vaccines could go to rural areas as opposed to Detroit, and wanted to know what prompted the change in that respect, and are we concerned at all that adding another slightly less effective vaccine to the supply would discourage residents who might have some hesitancy in getting the vaccine?
I haven't changed at all. So Johnson & Johnson is a very good vaccine. Moderna and Pfizer are the best. And I am going to do everything I can to make sure the residents of the city of Detroit get the best. And so, as you know, I went to the White House, got a commitment for 15,000 a week of Moderna and Pfizer. We've been enlarging it, and this week we've got 29,000 Moderna and Pfizer vaccines, 17,000 first doses, 12,000 second doses. Those Moderna Pfizer vaccines will cover every single Detroiter looking for a shot. Next week, I expect us to have between 25 and 30,000 more Moderna and Pfizer vaccines. And again, I believe we will have a Moderna and Pfizer vaccine for every Detroiter who wants one. The day may come when we have more Detroiters asking for vaccines than we have Moderna Pfizer, in which case we'll set up a Johnson & Johnson site. But I'd say for the foreseeable future, I feel confident that we will have a Moderna and Pfizer vaccine for every Detroiter who wants to get vaccinated.
Okay, and a follow-up from Christine Ferretti. She wanted to know if by not accepting the Johnson & Johnson vaccines, did any Detroiters miss out on an opportunity to get vaccinated?
Again, I don't know how to say this any clearer. We got 29,000 Moderna and Pfizer vaccines. That covers everybody who wanted a vaccination this week. And so if we can cover everybody in Moderna and Pfizer, we're going to do that. So if you take what Hakeem and Elisa are doing over at TCF, they max out at 5,000 cars a day. There is literally no more parking spaces. So 25,000 of the 29,000 will be administered over at TCF, 2,000 at the senior Saturdays, and 2,000 in the health department outreach. So at this point, everybody in the city of Detroit who's eligible, who wants a vaccine, can get one. To my knowledge, the only place in the country where now, if you're over the age of 50 with a chronic condition, or you work in manufacturing, you work in grocery stores, call right now. You'll get through in a matter of a few minutes. You'll have an appointment within a few days. Every single Detroiter who wants a vaccine has a Moderna, Pfizer vaccine available to them right now.
Okay. Christina Hall from the Free Press wants to know if we know yet when the next round of Johnson & Johnson would be coming to the city.
Yeah, we don't know. I'm going to say this as best I can. The Johnson & Johnson vaccine is a good vaccine. 70% of the time if you get it, you won't get COVID. And if you're in the 30% that do, there's a very good chance it's mild and you won't be hospitalized. If you get 2 shots at Moderna and Pfizer, there's a 95% chance you won't get it, and the 5% who do is a very good chance it's mild. The problem is that with Moderna and Pfizer, you got to get 2 shots. And so as a city, that's really complicated. It's complicated to schedule somebody, move them in, get them in a shot, take care of them, get them out. And to do it twice is twice as much work. In this city, I think the relative improvement in your health protection is worth us doing twice as much work. And so because you have the good fortune to live in the city of Detroit, where you've got a TCF operation that will schedule you twice and put you through twice, you're going to get a chance for the higher level of protection. The day may come in March or April when every single Moderna and Pfizer is committed and we still have people who need a vaccine. And at that point, we'll set up a Johnson & Johnson center. I don't see that in the next couple of weeks.